You know, for decades, the same type of treatment has been used for scoliosis, those big back braces that can be devastating for the image of a concerned teenager. But now there's something new in the treatment of the curved spine.
So come on over to vibrational traction.
Brianna Yeager is 15 years old. 3 years ago, her family got this news.
I think I was 12, and we were at the doctor. They just saw that my back was kind of like shifted, I guess.
As a parent, I was, how I felt badly that we had missed it, and so much time had gone by.
Brianna started treatment with the traditional back brace. It was cumbersome, uncomfortable, and unfortunately, it wasn't working. But 4 months ago, she found Dr. Michael Farrell, who explains to us what causes this curvature of the spine that affects about 5% of people.
A patient with scoliosis has a loss of curvature in the neck, typically a loss of curvature in the mid-back, and then their spine deviates in this plane of motion.
His treatment is called Clear, and it gives patients an alternative to wearing the rigid back brace for 23 hours a day.
So it takes about an hour and a half to get through everything. And then they just put me on all these tables and then the chairs, which help correct the back.
Those tables and chairs accomplish what is called mix, fit, and set, all therapies working together to straighten the spine. Mix loosens up the muscles and tendons, fix is the spinal adjustment, and set locks the spine into its new position.
The active rehab chair that you saw, that's designed to stretch and strengthen those muscles. The vibrational traction, that's designed to work with the white tissue, particularly when you look at the spine from the side in the neck and in the mid-back or low back. The flexion distraction table, that mirror images the spine, and then it stretches it over and over and over again.
Brianna is seeing improvement and very happy to have the freedom to play sports and not wear a brace.
I play left in volleyball, left forward, and then for softball I play center field.
So as a mother, I do hope to be able to give her that confidence, that she looks normal, and can fit in.
So if the Clear technology is not covered by insurance, that's the tough part. Dr. Farrell's office is one of just a few in the country offering this new treatment.
Hey, coming up after the break, we are...
He likes to nap. It reminds me of that Seinfeld, George Costanza built like a little house under the desk.
He's a napper. Hey, it's time now for our medical mundane. This is no joke. It's a big problem for a lot of people across Colorado. It's called the chronic headache.
Well, now a new treatment is developed right here in Colorado. It's helping people, and it all starts in the spine. Deborah Takahara has more on this new headache treatment.
Around 45 million Americans suffer from chronic headaches. Jane Bradley is one of them, and pain had become a part of her life.
I would get pain starting here, and then it would radiate around up to the front of my head, and it would cause really bad headaches.
She would get these headaches 3 to 4 times a week.
I feel like I walked around being exhausted most of the time because the pain was just chronic. It was depressing to think of living my life with this constant pain.
All right, Jane, come on over to decompression.
She says she tried everything, physical therapists, chiropractors, all kinds of pain medications, and nothing was helping. Until now.
From the very first appointment, I had relief.
She goes for treatment twice a week at the Spine Correction Center of the Rockies in Fort Collins, where Dr. April Cardwell is using new technology to change Jane's life.
So in the normal spine, when you look at it from the side, there should be a curve in the neck.
Dr. Cardwell says many chronic headaches start right in the spine.
This allows for the body to not have tension on the spinal cord, and then the nerves have no pressure on them. When Jane came into the clinic, her spine on x-ray was very, very straight like this. She had pressure on the nerve roots, which led to problems with the musculature, causing that radiating pain that came up into her head. So when we began her care, we started focusing on not only relaxing the musculature in the back, but putting the curve back in so that this could function more normally.
The treatment? change Jane's body mechanics.
So it's going to do this up and down motion to relax the musculature, as well as the disc tissue, kind of pump that tissue in there so that she gets not only pain relief, but the pressure on the nerves release as well. Next, we'll move on to the vibrational traction unit, and what that's used for is actually putting the curve back into the neck.
The last step is called neuromuscular re-education. This machine trains your brain on how the muscles should move, teaching it better posture. And they use body weights to strengthen damaged muscles, muscles that tell your body how to stand. For Jane, even the Serapin injections she receives before the treatment starts have been a huge relief.
My life has changed because I, at one point, realized I'm not living with constant pain anymore.
Well, medical insurance may help pay for some of the treatment. We have a link to the clinic at kwgn.com/everyday.
She swears by it, so help yourself out. Hey, come on up next. We're going to tune up your finances, and we're going to explain why we have a studio audience filled with moms and twins. Yes, you're not seeing double. So after the break on Everyday.